Ladies and gentlemen, thank you very much for gathering up once again. Those who are still outside the main hall, please come in so as we can begin our afternoon session. Please, those still outside the main hall, please come in so as we can begin our afternoon session. Afternoon. Good afternoon. How was the lunch break? Exciting, eh? Yeah. Hatimaye tumefika siku ya tatu, siku yetu ya mwisho wa symposium yetu pendwa kabisa. There's an evaluation link going around. Please feel free. It's confidential. Give us your thoughts. Make sure you plug in your answers. They will be very useful for upcoming symposiums. Please. We will be beginning our lecture update today, and our concentrate today is on cardiovascular area and medical emergencies. We have wonderful presenters with us, but we'll also hear from our esteemed partner and our industrial partners. They'll have a talk, but we'll also get an opportunity to hear from our facilitators, and I will request the trainees to pick someone who is going to do a vote of thanks. Okay? Thank you very much. Once again, good afternoon. Good afternoon. Looks like people have not had lunch. Good afternoon. Yes, as I said earlier, we thank God. We are on the third day. Thank you very much for your participation, for all our trainees, and for all our facilitators who have done a great job. There are no words to say, but we thank you very much. It was a journey over 3 months just to make this SEMC pilot to be held these 3 days. But it is a journey of over 10 years for EMSA for what we see today. Spearheaded by a very wonderful team of our delighted, lovely chairperson, Dr. Sylvester Fire. Together with his team, they have made this possible. At this juncture, I'd like to welcome once again Dr. Sylvester Fire for opening remarks for this afternoon and for the closing ceremony. Let's put our hands together for Dr. Fire.
Good afternoon. I don't have many words at this time, but I'll take this opportunity to say thank you. We have had 3 very fruitful days, challenging and at times a little bit frustrating, but that's part of life. Life is full of frustrating elements. But if I have heard correctly from some of the attendees of this conference, in general, they are happy. They are happy in the sense that they have taken some time to come and join us. So, in a way, I'm very delighted for the fact that we seem to have done something nice. So, please accept my thanks on behalf of EMSA. As the MC said, this is only the first of many to come. We hope we'll be able to achieve what we are planning. We plan to have another one in Dodoma soon. We have another planned for Arusha. We have another one planned for the Lake Zone, Mwanza. And we have another one planned for the Southern Zone in Mbeya. Finally, we have one planned for Mtwara in the south. So that we don't get accused that we are forgetting Mtwara again. So we have Mtwara in mind, definitely. We hope the turnout will be as good as this one. We already have started receiving inquiries and submissions for the course. Some have even paid up already for the course. So it looks good. So far, it looks good. Let me end up by saying there are 2 other gentlemen sitting here in front of you. They'll present their side. Shall I leave it to you to introduce them like that? Because, no, you come. Because apart from the fact that he's a student of some of them, it would be proper that a student introduces his teacher. Come.
Thank you, Dr. Fire, for the wonderful remarks. But before we introduce our guest of honor, I think the Master of Ceremony has got a few presentations this afternoon, and we would like to recognize our guests from the presentation side, and then we move with the timetable, and we come to introducing the guest of honor at the end. Please, go ahead.
Thank you very much, Dr. Rama. Yes, wonderful. As I said earlier, it's a third day. Now, third day comes with a lot of things, but comes with wonderful and great things too. But let me just remind you that in the past 1 week, the first international primary health care conference happened in Tanzania, and it was hosted in Dodoma. If we were all following, a new service number was launched, emergency caller, that was dial 115, and this is to aid the access to mothers and babies. Okay, so this is just a reminder that as we go back to our hospitals, to make sure we have all this aired, because this is what EMSA, what SEM is supporting. Everything that is concerning emergency medicine and critical care. Ladies and gentlemen, this afternoon we are graced by our wonderful industrial partners from EMERGRNCE, and at this juncture I'd like to welcome Mr. Arun for a great presentation. Let's put our hands together for Mr. Arun.
So, very good afternoon to everyone. So, this is me, Arun. I am the country manager responsible for business for EMERGRNCE Pharmaceuticals in the country. And on behalf of EMERGRNCE, we are very much glad to be a part of your very big program. And I should appreciate the ideology of having this type of emergency medicine capacity building in the country, which is very, very needed. And I appreciate the EMSA as well as the SEM team for getting this program, and I wish them all the best to go further growth from here. And with this, I will not take much time. I wanted to have some few words about my company, EMERGRNCE, and then one of the major product which we deal in emergency medicine, that we would like to have a presentation. And I know today we have a lot of programs on cardiovascular disease. The chief is there, so let us listen from them. So for me, just few minutes, yes. And coming to this EMERGRNCE Pharmaceuticals, you can see we have been driven with the purpose to develop, manufacture, and to market the broad range of pharmaceutical products across the globe. And we are happy to be having a major presence in major therapeutic segments like cardiology, gynecology, and blood-related products, and oncology segments. So all the major therapeutic segments, EMERGRNCE is there in the presence. And also we like to develop our biosimilar products. Already we have 6 biosimilar products, and out of which 3 of our biosimilar products are number 1 in the country, India, and we are exporting to more than 75 countries globally. And this is the EMERGRNCE's journey, so which we started incorporation in 1981, and in early 1995 you can see we have started pioneering in the chiral technology. EMERGRNCE Pharmaceutical is one among the big pharmaceutical company who have the chiral products. So which is like, for example, if you want to take S-amlodipine versus the normal amlodipine. So S-amlodipine is a chiral form of normal amlodipine. So this is one example. So similarly, we are pioneered in many such chiral products in the country, and we are having the presence in globally as well. And later on, you can see in 2012 we have our operation started in Europe, and as well as in 2014 we acquired the Telomed Pharmaceuticals company from UK, where we started as EMERGRNCE UK Limited. And in 2015 we started our presence in Canada. So we have our approval in the Canadian market to have our EMERGRNCE presence. And in 2022 we have our first indigenous mRNA vaccine for COVID. So this is remarkable achievement for our company during the need. Entire world is needed. Our company has come forward with a short time. We could able to develop the mRNA vaccine for COVID. And in 2023, we got the approval from the European Regulatory Authority to have our mRNA vaccine to be used in Omicron variant as well. So these are all the major milestone achievements for the EMERGRNCE Pharmaceuticals company. And our core values, if you see, we have integrity, value-driven, teamwork, and respect quality and patient focus, and innovation. So these are all our core values. And this is in snapshot. We are ranking number 13 in India, and we have a global presence in 75 countries plus, and 9,000 plus employees working day in and out for serving the patient who is really needing the medicines. And next slide. So this is our global presence. So you can see, name any continent, EMERGRNCE Pharmaceuticals is present. And in Africa, we have Kenya, which is our subsidiary, Laser Pharmaceuticals. And South Africa, we have our presence in subsidiary form, and as well as in Nigeria. So these are the 3 countries in Africa we have our presence. And this is the key API highlights, where we are the fastest growing and diversified international business. We have a very strong R&D focused backup, so which giving us the boost to go for very good higher end molecules to manufacture. And as I already told, we are very pioneered in the chiral technology, and also to develop the larger molecules in the API, which is very, very difficult for many companies to think of. But EMERGRNCE Pharmaceuticals is having its present in biosimilars. Next slide. And this is a global accreditations what EMERGRNCE is having. So you can see n number of companies, countries presence, approvals we have. So with this, we are having a remarkable presence and spread over across the globe. And thanks for all the support, including the TMDA was very much supportive in bringing up all our EMERGRNCE products in the country. And these are the few products which we are highlighted here. The pioneers in chiral technology, brands like Asomex we have, and we have infant product dexketoprofen, and these are all the chiral molecules. And biosimilar products, we have tenecteplase, that is Alaxim, used in critical care emergency, and we have Wintor product and Hamsil, and as well as in antiretroviral, we have a wide range of products in antiretroviral therapy as well. And this is which I wanted to inform you here. This is upcoming one. Currently we have a tenecteplase 52.5 mg, which is widely used in the country, in Tanzania and many other countries. And here 20 mg of tenecteplase for acute ischemic stroke, so which we already filed under TMDA. So soon, anytime once the approval comes, we will be launching tenecteplase 20 mg as well for treating acute ischemic stroke as well. Can you play this video? And this is one videograph presentation about our product tenecteplase.
of reocclusion.
as quick as possible. And thank you once again for SEMC and as well as EMSA team for giving us this opportunity. Thank you. All the best for all of you.
Together for Arun and MQ. Ladies and gentlemen, we have a very long list of participating hospitals from both government and private hospitals. I'll go through the list, and if you're in the building, if you're in this gathering, please, by show of hands, let us know your presence. We have doctors from Mwananyamala Hospital. We have doctors from Aga Khan Hospital. We have doctors from Amana Regional Referral Hospital. We have doctors from Atanazia Hospital, Cardinal Rugwamba, Early Specialized Polyclinic, E+, Flying Doctors Services, Jakaya Kikwete Cardiac Institute. We have doctors from Kwema Health Center, Mabupande, MDM Urology Clinic, MNH Mloganzila, Moi, Niham Dispensaries, Ocean Road Cancer Institute, Salsabil, Sanitas Hospital, Saifi Hospital, Sri Hindu Mandal, Tanga Regional Referral Hospital, Temeke Regional Referral Hospital, Tindwa Medical and Health Services, Tumbi Regional Referral Hospital, Ubungo District Hospital, and Vijibweni. We have a total of 32 hospitals participating, dear guest of honor, which brings us approximately 250 trainees who have been trained for these 3 days under the guidance of our 21 facilitators. At this juncture, I'd like to welcome our esteemed partners from Saifi Hospital, Dr. Mufadal, for a short presentation. Let's put our hands together for Dr. Mufadal.
Good afternoon, everyone. I'm Dr. Mufadal from Saifi Hospital, cardiologist. So the topic given to me today is chain of survival in STEMI. So chain of survival in STEMI. So in this very short span which has been given to me, we'll try to cover what is exactly the chain of survival in an ST elevation myocardial infarction, right? So slide please. So by the time the slide is getting loaded, so what idea do you all have? What is a chain of survival in a ST elevation myocardial infarction? So what is your concept of a chain of survival? Anybody who can volunteer? Okay, fine. So first, next slide. So first we kick off with an icebreaker slide. So it's just an ECG here. Next, please. So since this is the STEMI lecture, so it is an ST elevation MI. So which is the most likely artery which is occluded here in this ECG? Everybody can see the ECG? So what looks like the most likely artery to be occluded here? Anybody from the students? So RCA. So yeah, the RCA has been occluded. So what is exactly the chain of survival? So this is the chain of survival. So in plain and simple words to put it, chain of survival is when the patient has symptoms and the patient reaches and patient has a reperfusion. So between this time, the patient has to survive. So that part is called as the chain of survival. So it basically includes, according to the American Heart Association, this is the concept given for chain of survival, which includes early symptom recognition and call for help. That is the first one. Second is the emergency medical services, the ambulance or whatever, that for evaluation and treatment. Then after the patient reaches the hospital, the emergency department treatment and evaluation. And last is the reperfusion therapy. So this forms the chain of survival in patient of ST elevation MI. So what happens normally? So if a patient has a symptom of chest pain, so either the patient is near a PCI center, it goes to a hospital nearby and it is a PCI center, PCI is done, that is the best case scenario, but that is not always applicable. So what is the next thing that happens is patient goes to a non-PCI center, first an ECG is done, ECG shows an ST elevation MI, and then the doctor, emergency doctor there has to decide whether what step has to be done next. So that depends upon the time to reach a nearby PCI facility. So if the patient can reach a PCI facility within the next 2 hours, you transfer him to the next PCI facility. If not, then you use fibrinolytic agents. So by that time, what is to be done? By that time, what immediate measures can be taken? So first thing is give antiplatelets agent loading dose. So that is basically includes aspirin. Usually we give aspirin 300 milligrams, clopidogrel 300 milligrams, and atorvastatin 80 milligrams. So this is the standard procedure which has to be followed. It's not just that when you see a STEMI patient, you just send the patient to a PCI center. First thing to be given is a loading dose. So by that time the patient reaches the hospital, this is an important thing which has to happen. Next. So what are the factors which are deterrent to this exactly? So first is things like weather and climate, road conditions are bad, infrastructure is not good, traffic congestion, patient is in a remote location, and lack of a nearby PCI center. So all these are common deterrents where the patient cannot reach the hospital as quick as possible. So usually the treatment, there are two treatment strategies which are suggested. First is the best one is the patient is directly transferred to a primary PCI center. And second is if the patient cannot be immediately transferred within 2 hours to the primary PCI center, the other option is a fibrinolytic agent can be given. Next. So just to summarize, why is there a delay in the STEMI care? So first is main thing is the unawareness of symptoms and low literacy rate. So patient has had some kind of chest pain, they try to ignore the pain, that this may not be cardiac. So that is one thing. Apart from that, delayed transportation, less interventional cardiologists who are there around, lack of PCI facilities who are round the clock working and are nearby, affordability is a problem, delays in patient and relative consent, and inaccessibility to remote areas to 24/7 medical care. So these are the common problems. So just to summarize, if a patient suppose is in a far off area, say in Arusha, and they want to come here, so what exactly has to be done by the emergency medical team? So first thing, after the patient says that I have chest pain, as soon as possible an ECG has to be done. The doctor who is there after a STEMI is diagnosed has to give antiplatelet agents and then decide whether that patient can reach a nearby cath lab or PCI capable center or not. If not, then fibrinolytic agents has to be given. So this is the common thing. Next please. So yeah, so this is just the take home message that early symptom recognition, guide patients for an immediate ECG, call the ambulance and contact the cath labs in Tanzania which are capable of a primary PCI, and the cath lab team should be pre-prepped and ready before the patient arrival. So yeah, now Dr. Kuzema will continue regarding the cath labs in Tanzania and how to go ahead with exactly the patient care, right? So thank you everyone for listening and all the best.
Good afternoon, everyone. Thank you, Dr. Mufadal. I'm Dr. Kuzema.
Thank you so much, Dr. Mufadal. Before he speaks, we are blessed with the first interventional cardiologist in Tanzania, and is coming from JKCI. Please give hands for me. Dr. Kuzema, having you here is a resource to us. Welcome.
Thank you. Thank you very much, Dr. Ramadan. So as we say, let me talk about Dr. Ramadan then. When EMSA, he brought EMSA to Tanzania, I think it's almost 10 years now. and it started at Regency Park near TMJ with Dr. Fire, who supported them, and it was very in infancy stage, but now we can see that it's turning to an adult, and I can see everyone here, and how emergency medicine evolved with the first emergency course starting in only 2013 in Mwimpili, and 2010 first emergency course in 2010, which was with MUAS, which was given by MUAS, and now you can see how emergency medicine has grown, and where I am taking this subject to, without you guys, it doesn't reach here where I want your patient to be. So you are the first chain of survival for those patients who comes with STEMI. And this is my message to you all, that the recognition of the pattern of the STEMI is in your hands, not in my hand as an interventionalist or a cardiologist. It starts with you guys. You are the peak, the point of recognition of this pattern. And we are glad that now things are working in our favor. At the moment, we have a very big, large network of STEMI WhatsApp group, which over 900 doctors from all over Tanzania. They share the ECGs. We give them feedbacks. We give them the way they can manage if they are in a remote areas for these patients, and how they can transfer these patients to us for tertiary care. But the primary point is that the recognition of the pattern, as Dr. Mufadal said, and the first-hand medication to be given to this patient within the time frame of that 90 minutes to save that muscle. And that's why I always say time is muscle. So I'll take you to the presentation which I was given, was that what are the cath labs available in our country. I mean, this cath lab is like, you know, it's a luxury. Definitely it's a luxury. We didn't have any cath labs in 2014. The first one was installed in 2014. And we are lucky now we have got 7 cath labs in the country. However, 6 of them are in
At this juncture, I'd like to welcome Dr. Moise Adamji for greetings from Shifa Hospital. Please let's put our hands together for Dr. Moise.
Good afternoon to my Muslim brothers and sisters. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for this opportunity, Dr. Rama, Dr. Faya, EMSA. I'm Dr. Moise Adamji. I'm an emergency physician from Shifa Pan-African Hospital. Many of us have been asking, where is this hospital? This hospital is in the heart of Kinondoni in Tanzania, and it's a 250-bed hospital, which is going to be a state-of-the-art hospital as per what my managing director says. But I believe so too, because it's going to have everything that Tanzania needs, and its mission is to transform healthcare in Africa. That we are planning to do via training as well as by building infrastructure so that doctors like who are in Tanzania, nurses who are in Tanzania, can have the same playing platform as doctors in India or USA. Majority of the times, if you look at it, we have 3 issues in Tanzania. 1 is infrastructure, 2 is training, and 3rd is mentorship. And Shifa Pan-African Hospital is targeting to provide these 3 things to doctors and nurses who are working there as well as elsewhere. So this conference, I believe, is going to be the start. And inshallah, next time, we are going to have this conference at Shifa Pan-African Hospital. And I invite all of you to be there. Thank you so much, Dr. Rama, for being my mentor. Thank you, Dr. Faya, for being there, for always being there for EMSA and supporting us. I would like to share a story. I was an intern in 2017, okay? And Dr. Rama was there who was teaching me. I wanted to be a cardiologist like Dr. Kuzema, but Dr. Rama influenced me so much that I now am an emergency physician, and I'm very proud to be one. So thank you, Dr. Rama, for that. And thank you, Dr. Faya. Thank you, EMSA. Thank you, SAMS, for this opportunity.
Thank you very much, Dr. Moise. I am glad that you are motivated to become an emergency physician. Yes, you are. I met Dr. Rama in 2015, and I'm not yet an emergency physician. Now, that is not your problem, neither my problem. But I'll tell you something, I love being at the emergency unit. Doing what? Saying hi to my cool colleagues working at those units. Ladies and gentlemen, up next is our technical director from EMERGRNCE Medical Services Academy, no one else but Dr. Rita. Let's put our hands together as she approaches the podium.
Kwa jina la Jamhuri ya Muungano wa Tanzania. Tuko Tanzania na wote tunamuunga mkono rais wetu Daktari Samia Suluhu Hassan. Na haya ndio mambo anayoyataka. Ndivyo sivyo? I believe everyone speaks Swahili. I'll deliver my presentation in English, but at some times I'll put Swahili words. I acknowledge the presence of all my seniors, Dr. Faya, Dr. Rama, my colleague, the president of THS, Dr. Chilo, he'll be introduced. These are my close colleagues, but I also have a number of colleagues who had undergone the same training. I have Dr. Sarah, my colleague and my close friend. Hizi ni chai tu, kupata confidence sawa. Great. I'll be providing an overview and some activities that we are doing at EMSA. Some of you might be aware of them, but it is not bad to repeat so that you can be our ambassadors as we scale up the same key activities across the country. It is difficult to deliver a speech once you have the technical gurus have spoken. We've had a hard science, from the JKCI colleague, the interventional cardiologist in the country. Then Dr. from STAFI, from MCQ, right? MQ. So this one is a little bit soft science. It's not hard science. It's knowing who is EMSA, what are we providing, and what is available for you and your colleagues as you are the frontline workers to save the life of many Tanzanians. So we've had a vision as EMSA that we've walked through for the nine years, and now we are walking through our 10th year. That will be marked next year in March, and we'll be celebrating with all of you who have been part of the journey. EMSA is accredited. We are not just offering these services as just anybody else, but we are accredited by international bodies, and we are well known across the globe. And we've been providing these services for a while, and we are accredited by the American Heart Association as a training center, and we are offering the trainings that we've been receiving, and many of other frontline workers who have already gone through EMSA's training. Am I losing the slides? Okay. We are also accredited by the International Trauma Life Support, ITLS. You've received the training, some of you, as well as the MCT, the one that provides us with CPD. And also the SEMKI has a CPD you're all aware of. We have a number of arms, but one of the core arms is healthcare workers, human resource capacity strengthening. That is our core arm. We have other services that we are providing. And this arm is what brings all of you here for capacity strengthening. And would like also to speak about our physical presence. We are saying we are here for 9 years. Now is our 10th year. We have offices, physical offices. It's not only seeing us, because today we're at CBD, the other time we're at Regency, sometimes we're at JKCI. Those are training venues. But we have a physical presence along the along Al-Hassan Mwinyi Road at Victoria area. Our offices are open Monday to Friday, 8 to 11, 8 a.m. to 11 p.m. So you can reach out to us. We have our social media pages. You're all aware of them. We'll see them at the end of my slides, but also have other contacts that you can reach us for services. What is EMSA bringing to us all? So in particular for the HRH, or Human Resource for Health, who are we targeting? We are a mixture here. We have physicians, we have anesthesiologists, we have senior medical officers. Strategically, at Dodoma, we understand we have a big hospital. It is our capital city. It should not be left behind, but there are a number of regions that are surrounding Dodoma region. How can you participate? This time, we really acknowledge the EMSA management team under the chairmanship of Dr. Fire, who were very lenient and sponsored 99% of this symposium. Applaud to them, please. But we encourage individual sponsorship. You can register. Tell your friend to start plan participating into this. But also, for those who are interested, you can sponsor a delegate. That is another easy way to participate. If you have a colleague, unaweza ukamchangia kibubu kidogo, right, to participate into our symposium that are upcoming. And we have a number of events that can be sponsors. Normally we have a networking dinner gala that a partner can sponsor. We have breakfast session for recognition. We have lunch sessions. We also have faculty dinners and a number of activities that one can be interested to sponsor or sponsoring a delegate. I would not complete my presentation without acknowledging all of you who were able to participate in our kick-off STEMKey activity in 2024, which is actually, we are so proud as EMSA as we are walking through our 10th year anniversary that we will mark next year, being able to realize this dream. It had been there for a while. It was not easy, but at least the baby has started to crawl, and we are very sure that will be running very soon. So acknowledgement to all the public facilities, providers who were here from the public facilities, private facilities, our industrial partner, and the EMSA management team. Asanteni sana.
Thank you, Dr. Rita. Before MC takes over, I just want to recognize one partner that was interested to be here, and he has actually come during the time that the event is going. I just want to recognize the presence of CADMED. Please, CADMED team. Thank you so much for supporting this event, for supporting all this staff from Dar es Salaam. Remember, anything happens to you, you will run to Muimbili, you will run to Aga Khan, you will run to Seifi. So thank you so much for supporting this event.
Yes, thank you very much, Dr. Rita. Let's put our hands together once again. So we acknowledge, on behalf of the acknowledgement, the Association of Physicians of Tanzania, AFITA. Thank you very much also for your participation. Ladies and gentlemen, I just want to share with you what I picked from her presentation. Training local instructors means we are bringing it and making it local, right? But something I was thinking as she was saying, that you can explain most of these terminologies in the local language. Now I am still wondering, what is the nectar place in Swahili? I am still wondering, what will you tell thrombolytics in Swahili? Now it is also a task for us to go back and change some of these guidelines into our local language, because we are also pushing Swahili to be acknowledged. Even in our profession, we can help that exercise to go further. Without wasting time, ladies and gentlemen, let me welcome once again Dr. Ramadhani Chunga to invite our guest of honor. Thank you. Let's put our hands together.
Thank you so much, Dr. Edmund. Before I invite our executive chairperson for EMSA, who will invite our guest of honor, I would like to make a few comments, if you allow me. When I was attending my training as emergency medicine program in South Africa in 2015, one of the questions that I had was looking at South Africa, where am I going to practice all this knowledge that I have? That was my basic question. To be honest with you, we were graced that year, something new came. And that new something created massive investment in healthcare everyone today is proud of. And with that esteem, I would like to say we must celebrate the great investment that has been done in emergency and critical care. Having hundreds of EMDs in Tanzania is not a joke. Having ICUs in regional hospital is not a joke. Having all this in the zonal hospital is a massive investment, and coming for people who are not doctors. This is the cry that we have been having for many years, that medicine is left out. Understanding at the time that the health budget that was actually put by WHO was below the par, but now I think is exceeding. Thank you, the government, for all these efforts. And it is our job now, we as professionals, to realize and support by training the non-physician level, while the government is giving us the infrastructure and expertise investment. This is something that I didn't want to left it out. And I'm investing and giving back my knowledge that I received from South Africa through educating everyone to every corner in this country. One thing that I wanted also to highlight is that when we hear of emergency medicine, we think it's only for EMD. We do have emergency everywhere. We do have obstetric emergencies, we do have pediatric emergencies, we do have surgical emergencies, we do have orthopedic emergency. So I would like to call upon to redefine emergency medicine. When we called people to bring us, when we called the facilities, bring people working in emergency, they brought only those working in the emergency medicine department. Everyone in the hospital is involved and has to be trained on the basics of emergency care. We also mentioned and want to recognize that the bulk of health system are not specialists. Dr. Kuzema mentioned it depends on us to have the patient sent to JKCI. JKCI is actually mostly, if you ask the cath lab, probably is saving maybe 10% of what is supposed to be saving. But the main problem is identification of someone who has got MI. If we get that person who has got MI, they are going to have a primary PCI done. And mostly, they are not to have someone who has got a heart failure today. I can tell you, I sometimes recognize their effort. JKCI physicians, specialists, they are working at 4 o'clock in the morning to see people because they are overburdened with patients. And these are people who are in stage 4 cardiac failure. They are working tirelessly to save these people, but we can do a lot by saving the muscles and they will not having ejection fraction of 20s by just giving thrombolysis as early as possible and save their muscles and they retain their ejection fractions. So gentlemen, we need to work hard to make sure that we embrace this achievement that we have done. We need to continue investing on the lower cadres, and that does not mean doctors only. We mean nurses, we need clinic officers, we need even far, we can go home. Because when Dr. Fire gets something at his home, he's not going to call Dr. Chunga. He's not going to call Dr. Kuzema. Dr. Kuzema, I know you are the best interventional cardiologist. He will call his wife. And his wife has to do something. We learned about the activation of emergency system. That emergency system is the wife. And we are not going to call 07134. She's going to forget all of it. And this is the other way I want to celebrate the achievement that the government is making of inaugurating the 115. This is the 911 of Tanzania. We have to embrace it. We have to train our colleagues. I know we have seen numbers like 114 being abused by our colleagues in the community, that for fire. We have seen probably number 112 being abused, the police number, but these numbers are our chain of survival, our chain of stopping crime, our chain of putting on fire. Sometimes we are complaining of the fire came late because we have been abusing that number. So they feel that, oh, these are the same people that are trying to abuse us. So if we don't abuse it, it means it's going to save life. The same number, if we abuse 115, definitely a life of a baby somewhere, a life of a mother somewhere is going to be impacted. So we congratulate you, give hands to the government for inaugurating this number. I just want to add one thing on that. If it's possible, that number. I have seen an experience from South Africa where during 2010 World Cup, they rerouted that number to 911 because we do have tourists coming in. They don't know 115. They remember 911. So 911 call is rerouted to 115 and they get the service. If that can be done, it's going to add and make a difference. Before wasting much time from the guest of honor, I would like to call Dr. Fire to now welcome the guest of honor to give us a speech.
Clarifying something before I make a stupid mistake. And when you get to a certain age, you start asking stupid questions as well. I have the pleasure of inviting a colleague. Most of us associate him with Tanzania Health Summit. When you see him, you know it is Tanzania Health Summit. And that's the way I've known him. I've known him as the man behind Tanzania Health Summit. Well, he's been at it for some time. I'm glad to say it has been getting stronger and stronger. We, EMSA, look at him as a beacon. Someone who had a dream, a vision, and he's been able to make that vision possible. Rama had a vision, and he's trying to make his vision, his dream possible. So, I introduce to you Dr. Chilo. I've known him for many years. So we keep meeting here and there in interesting places, but mainly as far as training is concerned. So, at some stage, we were training his people as well in emergency medicine. We also train at his institution in many ways. We also have participated in the Tanzania Health Summit as well, training people at the summit. So we share a lot in terms of what we do. But he's been at it for a little bit longer than we have, so we look at him as somebody who is showing us the way. We learn on the way. Dr. Chilo, it's my pleasure to invite you.
Is it afternoon or evening? I'm out of. Thank you so much. So when I was coming to this venue, Dr. Rama and the rest of the senior was taking me through some other venues to get some introduction on what was happening in the last 3 days. It was so impressive to see that a lot of educational materials, a lot of trainings, and understanding, sharing of experience between among yourself was wonderfully being done. So congratulations to EMSA, Dr. Rama, Dr. Fire, for the wonderful job that you are continuing to do since I met you 8 years, if I'm not mistaken. But when I was coming to this room, I found myself in an odd situation. I realize nowadays doctors don't wear a suit and tie. Like a friend of mine, Dr. Guzeima, probably next year I will have to change it if I be actually invited as well. So 8 years ago, Rama was actually coming from South Africa, and he was struggling to initiate the EMSA as well, and was also struggling to make sure that THS stand by itself. So we met them as hustler by that time. And maybe this is the reason that he invited me today. When I asked him, why are you inviting me? I'm not a politician. I'm just a physiologist mixed up with public health. I'm not sure who am I. So he just said, you just come and share your story probably, and also talk to our people as well. So before I start my, what we call the closing speech, I want to share my personal experience that made me, coming here, and also it encapsulates what we've been achieved here for 3 days. In 2010, when I was just fresh from intern, I found myself in the middle of, kind of mixed feelings of sadness because I lost one of my relatives. And we were attending this funeral in Tanga, Hande in Tanga. So when the funeral was ongoing, there's a crisis happened at the moment. A young lady actually collapsed suddenly, probably due to intense emotion to the moment, whatever. So there was a lot of panicking going around the venue. The scene. There's a lot of local women were crying. Others were trying to pour water and sponge, this water soaked sponge. She was sponging. And one of the women recognized that I was around. And he called me to intervene in the situation. So when I reached there was like 50 women around that young lady who collapsed. And everyone was shouting. It was like another funeral is going to happen very soon. So due to the situation, I instruct 2 young boys to take the patient to the back of the seat of my car for the intention to drive it to the hospital. But my inner intention was to try to save by doing CPR at the back of the seat, because the chaos will be probably gone by that time. So when the driver was driving to the district hospital, which was about 20 kilometers, I started CPR, and I also instructed someone else, to blow airs in and out, and I was doing the chest compression. And along the way, miraculously, this young lady is awake, and started to gain consciousness. And we reached the hospital. She was more stable, and she was admitted for quite some hours. And I instructed the doctor that to retain the patient till tomorrow, because I was afraid that this instance can happen again. So what does it tell you? It tells you that, and it reminds us of the importance of care. We have to be ready in very tough situations, and we have to work together. So without my presence, we don't know what would happen with this young lady who had collapses on that day. So dear delegates, colleagues, and some of you are my students as well. I know you're senior now, but some of you are very much students. So I'm filled with immense pleasure and gratitude for all of you who are here to this symposium. And thanks again to Dr. Ramadan and your team for this invitation. And being a guest of honor, I always been invited the guest of honor to come and either close or open. But today, it was my turn to be invited to be the final person to close the session. So thank you so much. It's not very easy to be a guest of honor, I'm telling you. So as a vascular physiologist, I did my PhD in vascular physiology and also basic science researcher. But also I co-founded the Tanzania Summit in 2014. So however, this symposium is in line when you look to the National Health Strategic Part 5, which was launched in 2021 and it will run to 2026. Emergency and critical care is well mentioned in the chapter 5 and 6. And this tells that even the government is aware of the importance of emergency care in its population. But also, this symposium reflects our journey toward excellence in emergency. We have seen EMSA being evolved, and this is probably one of the biggest gathering for emergency care training in this country so far witnessed. So this is also very positive in terms of your service you're providing. So through this symposium, you have been privileged to hear from a lot of distinguished guests, but also you've learned your care practices as well and make progress in your career. So it's important that also the government should advance this emergency critical care to the rural population as well, which is your target as well. So from establishment of emergency department in 2010, by then I think was that person from USA was establishing, is called what? What's the name? I don't remember that. It was with Abbott, I think. I was among of the first after intern, or the first cohort to be, join the emergency medicine, alongside with Dr. Juma, I think you're aware of him, and Professor Henry. But I was the one who denied to sign the contract, and I chose to go to physiology. So I was also supposed to be emergency physician, but that was unfortunate for me. And Mzirai actually, yeah, he called me during the evening and said, "You gonna sign or not?" I said, "Wait a little bit," and then he canceled it. So it was unfortunate. So, however, we have to be aware that it's only the healthcare professionals who must be equipped with necessary skills and knowledge, but also we have to consider the broader community. Together, we must stress the importance of emergency preparedness in the community to ensure that our health facilities are also equipped. In my opinion, we also need to think about developing a community-friendly guidelines or materials for people who are on hotspots for the emergencies. For instance, we did a study with our department and also with the emergency. There are a lot of hotspots for border-border accidents and crashes in this city, like in Buguruni, but also in Ubungo. And these hotspots are all in the bookshelves. But we need to provide people with EMSA and other players. We need to come up with, program or training material so that the people around this place can also be able to learn and support life. In this way, we could magnify our potential in terms of providing care to the people on the side. I once again congratulate EMSA and its players on the incredible work they're doing, and both to educate the physicians, but also non-healthcare workers on emergency care. However, in light of that, THS has been among the players in this field as well, although under low profile. We have been able to educate the community on basic life support with the help of yourself one time, and also TMHS. We educated on choking emergencies, how to manage them, on doing some simple CPR as well, especially when they meet with us during Tanzania Summit. So we are joining hands with EMSA as well to spread this a wonderful initiative to the community as well. So now let us carry forward these lessons that we have been learning through the 3 days. And we need to continue to connect and communicate in case of emergencies, but also in case of helps. Don't be afraid to call someone else who might be able to support you or to direct you with something to do in case of emergency. So our collective effort and connectivity will be able to empower more lives and save more lives as well. So as we depart from this symposium, let us determine to do what we're supposed to do, but also to make the difference in those people that we are serving. And for the power invested in me by you and your team. I would like to declare that this symposium on emergency medicine and critical care is officially closed. Thank you so much.
Dr. Omari Chilo. Let's put our hands together again for Dr. Omari. So something that I have realized is, you asked if I was also one of your students when we met downstairs. Fortunately, yes. Fortunately, yes. You know where? The first Tanzania Health Summit, I was a volunteer in that team. I went to Kairuki. We were a number of us, and I am sure that is the time when you recall me. But due to the suits we wear, things change. So you are surprised that most doctors now don't wear suits. Fortunately, I am yes, but yes also. We try both ways. Thank you very much once again. And this juncture, I'd like to give a special vote of thanks to the guest of honor will be given by Dr. Mzava. Please, I'd like to welcome you for a word of thanks to the guest of honor.
Jamhuri ya Muungano wa Tanzania. Maybe labda niseme kwa Kiswahili kama alivyosema dada pale. Mmepata bahati ya kuanzisha SEMKI. Hakikisha unafundisha mpaka wale wa chini yako. Elimu sio ya kwako mwenyewe. Elimu iende mpaka chini. Na uhakika EMSA watakuja kuangalia umefundisha wangapi baada ya miezi mitatu. Ndugu mgeni rasmi, kwa niaba ya SEMKI na EMSA, tunakushukuru sana sana kwa nafasi yako, kwa kuja kufunga mafunzo haya. Hii ni pilot ya kwanza ambayo imekuwa na mafanikio sana sana, na tunategemea kwamba baada ya muda si mrefu Tanzania nzima itafikiwa. Umezungumza habari ya kufika kwenye community. SEMKI EMSA wamelichukua, na hakika baada ya muda si mrefu tutaanza program za community health workers. Tunakushukuru sana kwa niaba ya SEMKI na EMSA pamoja na participants wote waliofika. Ninaitwa Dr. Christopher Mzava. Asante sana.
IDA Group. MDM Urology
Hi, this is Kenny G,
Specialized
and
Hospital.
here's my new video called Silhouette.
Representative from
and I hope you like
MDM.
it.
I'd like to call Dr. Mufadal. On behalf of Dr. Mufadal, someone to pick up his certificate. Dr. Evelyn Mapunda, our facilitators. Dr. Gimbo. Dr. Humphrey Mudaraki. Dr. Kilaro. Dr. Kuzema. Dr. Marco. Dr. Masuma. Dr. Bita. Dr. Bita. Dr. Moise Adamji. Ramadani. Dr. Teresia Lutufia. Dr. Winnie Bindo. Representative from MQ, please can I have the raffle draw? The raffle draw. Thank you very much, all participants. Once again, I'd like to thank our wonderful guest of honor. Now, MQ, as our partner, offered certain forms to our colleagues to fill in. We would like you to pick one amongst the number of forms filled at random, please, and I will tell you what next. Thank you very much. I would like to welcome representative of MQ up front to present the winner, the trainee who is going to be receiving this gift from MQ. Dr. This is Wakuganda. Eva Wakuganda. Sponsors and partners. let's wind up in a proper way, and then our instructors will let us know when our session ends.